Good afternoon, everyone, and welcome to United University Professions Mental Health Panel Discussion. First, United University Professions is commonly referred to as UUP. UUP is the largest higher education union in the United States, with nearly 42,000 active and retired members. This is our second panel discussion on the area of mental health care, and specifically the mental health care crises that are facing our nation. Last October, in a very historic event at Buffalo State College, now Buffalo State University, UUP held a forum that looked at how structural racism and generational trauma impacted our nation's ability to achieve mental health equity. Today, we are focused on the impact that the pandemic, combined with racism and social turmoil, among other factors, have led to serious repercussions on the mental health of students, faculty, and staff at colleges and universities across this country. There is an increase in the need for mental health care services happening at the same time as we experience a national mental health care provider shortage. And this in turn has created widespread challenges across campus communities. First, I want to express my sincere appreciation to our panelists, community members, legislative partners, and UUP members for being here today to listen, to learn, engage on mental health care concerns. We received questions ranging from mental health care benefits to best practices when working with students, colleagues, and subordinates, questions related to recruitment, retention, and the salaries of mental health care professionals, the impact the pandemic has had on mental health concerns in higher ed communities, requests for wellness advice, advocacy opportunities, how to avoid hurting someone who is seeking your help. So many topics, so many issues were raised. There's a lot to cover here today. In total, there were well over 150 questions submitted through the registration portal, and thanks to all of you who submitted a question. I'm going to begin with those, but if you did not have a chance to submit a question, please feel free to put it in the chat, and we will try to leave time at the end for our panelists to respond to new questions. However, I want to share that because of the overwhelming response and interest in this program, we will host another mental health panel discussion on this topic in August, right before the start of the fall semester. And we will do our best to add unanswered questions to that event. So let's begin. First, to introduce our incredible panel, I begin with a UUP member from the University at Buffalo Health Sciences Center, Dr. Saurav Sengupta. After graduating from Duke University, Dr. Sengupta completed the joint MD-MPH program at Tufts University. He did his adult and child psychiatry training at the Western Psychiatric Hospital at the University of Pittsburgh Medical Center. In 2013, he started Integrated Care for Kids, a collaborative care program in pediatric and adult primary care settings in Western New York, leading a team of therapists and care coordinators working closely with primary care clinicians to better manage mild to moderate behavioral health issues at, quote, the right time and the right place. He is a major participant in numerous programs in Western New York that are focused on mental health care and the training of professionals in these fields. Welcome, Dr. Sengupta. Another UUP member joining us today is Dr. M. Dolores Cimini, a New York State licensed psychologist and inaugural director of the Center for Behavioral Health Promotion and Applied Research and senior research scientist in the Department of Educational and Counseling Psychiatry, School of Education at the University at Albany. With more than 30 years as a clinician and translational researcher, Dr. Cimini has been a major force in research and care in mental health issues, particularly among young adults and specifically college-age students. Thank you, Dr. Cimini, for joining us today. Joining us from Stony Brook HSE, is Dr. Christy Golden. Dr. Golden has a doctoral degree in arts and sciences with a concentration in health administration from Union Institute and University. Previous to that, she earned a Master of Science degree in Education and Rehabilitation Counseling from Hofstra University and a Bachelor of Arts degree in Sociology from SUNY Stony Brook. She is a nationally certified as a rehabilitation counselor and licensed in New York State as a mental health counselor. She is currently the Associate Director of Operations for Neurosciences at SUNY Stony Brook University Hospital, including psychiatry, neurology, neurosurgery, and related areas. She is also the administrative leader for the development of telehealth. Dr. Golden also serves on several mental health related organizations' boards. Welcome, Dr. Golden. John Richter has been the Director of Public Policy at the Mental Health Association in New York State, MHANES, since January 2008. Mr. Richter joined MHANES after spending over 20 years serving and advocating for the elderly and people with disabilities. MHANES is a private nonprofit mental health advocacy organization with 26 affiliates that provide mental health services and support in 52 counties in the state. While at MHANES, John was instrumental in the passage of legislation that made New York the first state in the nation to require K-12 schools to provide mental health instruction as part of the school health curricula. John received his Bachelor of Arts degree in psychology from SUNY Stony Brook. He received his master's degree in public administration from the Rockefeller College of Public Affairs and Policy at SUNY Albany. Welcome, Mr. Richter. Lauren Finke is the Kennedy Forum's policy director, representing the Forum on state and national mental health and substance use disorder advocacy efforts and leading its youth and family mental health work. UUP has been working closely with the Kennedy Forum for the past year as we undertake massive efforts on behalf of mental health issues and the crises facing our country. Lauren works with government leaders, regulators, policymakers, and mental health and addiction stakeholders on issues around healthcare access and consumer rights, including insurance parity, crisis care, and youth and school mental health. Her work led to the successful passage of a number of comprehensive state mental health consumer protection laws that have been replicated in other states. She joins us today from California, where she has led some of these efforts. Welcome, Ms. Finke. So with that, we are now at the point where I want to stop talking and hear from our panelists. We are going to go straight to the questions that we have received and want to begin today with what I call the big picture questions. You know, the focus today is on mental health crises, specifically in higher education institutions and communities. So I will open it to the panel. Whoever would like to go first, simply unmute and go ahead. The question is this: how do you define the mental health crisis, both in terms of an individual's experience and in terms of the large-scale challenges in higher ed, unique to higher ed? What are the current causes for the present crisis in higher ed? So with that, I will go back to the Zoom and open up to anyone on the panel who would like to go first.
I would be happy to go first. I have been working with college students for over 30 years as a practitioner and also have been doing translational research in mental health and substance use. And over the years, it's been very clear to me that students are coming to campus with more and more complex mental health and substance use related issues. 10 years ago, it may have been depression that students were facing very, very frequently, but right now it seems to have shifted to severe anxiety and anxiety disorders, and substance use is also part of the bigger picture. In addition to that, the situation is complicated by a number of factors that have been contributing to students' challenges, including health disparities. More and more students are coming into schools in the SUNY system, experiencing health disparities, financial issues, homelessness, and the like, as well as having experienced violence and serious concerns along those lines. So it's become a very, very complicated picture. I will stop now and pass it on to other colleagues.
Thank you.
And
Ms. Finke, go ahead.
yeah, I'll just tag on to that. I think when we hear the word crisis, we often think of something that's been sort of launched into being by one like disastrous moment. And for a lot of us, we hear the word crisis and think, oh, this is something that's happening in a pandemic, post-pandemic world. I think what we're seeing with mental health today is not just that. I think it's a long-term, systemic failure to get people the appropriate care that they need, whether it's mental health or otherwise, right? We're seeing a rise in people who are coming in with co-occurring conditions of maybe addiction and mental health, or physical conditions that are so hard to live with that they have a mental health condition that's sort of accompanying that. So, I think what we're seeing is sort of a long-term, this has been an issue for a long time, right? This is not just something that's been happening through the pandemic and something that higher ed has had to deal with for a while now. And so the issues are really just compounding. And I think, to bring some hope into this, I don't think that means that there's not solutions either. I think that means that we really have many solutions that sort of attack it at multiple angles to make sure that we're dealing with some of the other factors that kind of come along with mental health issues brought up by the pandemic, brought up by social isolation and the social determinants of health that you mentioned, food, housing, job stability. All these things are really important for long-term sustaining mental health and wellness.
Yeah,
Thanks. Yeah.
so Fred, yeah, to continue to add to what others have said is I'm not disputing that there's a mental health crisis in higher ed. I agree there is, but it's important to look at the data that's been collected, because it's collected in a number of different ways and reported in different ways, and some of it is probably representing legitimate increases in prevalence of mental health disorders, but I think some of it too is increased utilization that can create the appearance of more incidents of mental illness among college students. So teasing those out is a little bit tricky, but I think in there's a little bit of a ray of hope, and that is if what we're seeing, a lot of what we're seeing is it does look like more mental illness, but it's actually more utilization. More people are trying to access mental health services, which is great. It means that perhaps stigma is being reduced. More people are talking about it. There's a little bit more awareness about mental health, that people are seeking it out. But it also, paradoxically, it puts additional strain on the system. And you mentioned us having a shortage of mental health professionals and mental health workers. And when I talk about the mental health workforce, I'm talking about the professionals as well as the supportive staff, the case managers, the mental health aides. All of those are in high demand. So yeah, I think we need to understand a little bit better about what's true prevalence and what's utilization. And there are still other factors. I'll let others respond to what the cause. The cause is a huge pregnant question.
I was thinking about what Lauren said too about this being building over time, and I think that we have to look even further back and say that the pressures that have been placed on this generation of kids in school to perform, to be involved in activities, extracurricular activities, and the pressure that's on them for the last 2 decades or more has just continued to build. And they are building and building and building to working parents. And then all of a sudden the pandemic hits and everything comes to a screeching halt. And now everyone is by themselves in their homes, not able to leave. So it was like a shell shock for many people to go from constant day-to-day running around, activities involved in everything, to all of a sudden not being involved in anything at all. So that generation of kids, they're coming into college now, they're in college now. And add social media on top of that. And it's a whole different world in terms of their interaction with one another.
Thanks. Dr. Sengupta.
Yeah, I appreciate all of my colleagues kind of highlighting the kind of broader systemic issues. I guess for me, a crisis is when the critical acute needs of the moment outstrip the resources you have available to address those, right? And so I think a lot of folks are talking about the systemic sort of crisis, and I'll leave those there. But just even at the individual level, just to kind of riff on Dr. Golden's comment there, I think one really salient aspect is the sheer amount of information that young people have to process constantly, every day, day in and day out nowadays. And that is something that is objectively different than, when you and I and others, were sort of growing up and coming up. And so, as for young people, this is a really big challenge. And these are often, the trainees that we're working with. And I think, we're sort of struggling to manage this onslaught of information as, the helping professionals, the teaching professionals, and we haven't really figured it out. And in this context, we have young, adults, young individuals that are struggling in their own ways. And that is, I think, the definition of a crisis, that we don't really have a way of understanding how to meet the critical needs of this moment.
I want to segue from what you were just saying, Dr. Sengupta, because it leads to our second question. As you point out, the challenges faced by the institution where you work and the clientele you serve. And that is, what can institutions of higher education do given the present situation as you all have outlined it? At the same time, what have institutions done in concrete terms that you can point to that indicate going back to the idea of some hope and some an avenue to deal with the crises as it relates to those in higher education settings? So what uniquely can these institutions do? What are the challenges they face in doing it? But also, what do you see that has worked and could offer an opportunity for expansion? And again, whoever wants to go first, feel free. Dr. Golden, go ahead. Yeah.
Just two things come to mind. One, some institutions, including Stony Brook, have put in place 24/7 coverage for students who come forward or need support during outside of business hours. So there are counseling services available immediately by telehealth and through other means to make sure that it's not just a 9 to 5 availability, that the universities have services, accessible services, easily accessible services 24/7. Something else I think that some universities, some school districts, even at the secondary education, primary education level, have done is they've accessed mental health first aid training. So mental health first aid training is it's a very simple training that's taught to any one of us, whether it's a faculty member or a parent or any kind of gatekeeper in the community. Gatekeeper meaning someone who will see things or interact with a student or a community member. And it teaches very simple techniques to recognize and understand when someone needs support, and taking away some of the fear of the conversation. So you don't have to be afraid to have the conversation with someone about mental health, even if you're not trained. Mental health first aid is just like physical health first aid, but it gives the person who is trained in it a basic understanding of how to help the individual who has come to them. And in this case, students.
That's great. Thank you. Dr. Chimini.
Yes, thank you. Some of the effective ways that we've addressed the mental health crisis nationally, and also to some extent at the University in Albany, is to take a comprehensive public health informed approach that is certainly to provide treatment and referral, and as examples, all of the things that Dr. Golden mentioned, but in addition to that, also offering screening, brief intervention, and referral to treatment to groups of students that may be at high risk for mental health and substance use concerns, actually reaching out to them and doing these screenings, and also at the population level, doing campaigns to reduce stigma and to educate students and to teach them ways that they can support their own health and well-being. At the University at Albany, in the early intervention area, we are actually teaching our undergraduate students, we're training them to do the screenings. These are students with lived experience with mental health and substance use, and we're training them. And then we're embedding these students in places where students naturally congregate. For example, in our Gender and Sexuality Resource Center, in our Educational Opportunity Program. So students then can just walk in and chat with a peer who has lived experience, and the peer can screen the students and refer them for professional services. Those are just some examples of an approach that might be effective on a number of campuses.
Thanks very much.